Hi everyone, Dr. Blessin here from Dental Loops. Hope you all are doing great. So in today's video, we are discussing the mechanism of action of local anesthesia. Let's start with a little history. So the first ever local anesthetic used for its anesthetic properties was nitrous oxide, which is also termed as laughing gas. And where was it administered? It was given to Dr. Horace for the extraction of one of his third molar. And moving on, the first as well as the first ever natural local anesthetic introduced into medical practice was cocaine. And the first amide local anesthetic used was lidocaine, which is used extensively in dentistry. And the rest you can see in the timeline here. Okay. So what do you mean by local anesthesia? We all know that it is a loss of sensation in a particular area of the body. How it happens? Due to the depression of excitation in the nerve endings or an inhibition of the conduction process in the peripheral nerves, which means the normal conduction process is inhibited somehow and then you attain the local anesthesia of that particular area. To understand the mechanism of action of the local anesthetics, first you need to know how a conduction process usually happens, a natural conduction process. To understand that, we'll need to know the basics of neurophysiology, that is the basic unit of your nervous system, that is neuron. Let's start with that. So here what you see are two types of neurons which we have. Each neuron has got three parts. One is axon, then cell body and the dendritic processes. Okay. So this is the axon, this is the cell body and these are the dendritic processes. Now we have two types of neurons. One is a sensory neuron which is given in the first picture and the second one is a motor neuron. What is the difference between a sensory and motor neuron? Let's see. See here what I marked as P is periphery. So what happens in a sensory neuron is that they take impulses from the periphery towards the CNS. Okay, that's how the sensations are carried out into our brain. And what happens with the motor neuron? They travel from the CNS to the periphery. That is, the impulses are traveling from the CNS towards the periphery of the body. So that is one main difference between a sensory and motor neuron. And the second difference, as you can see in the image, is that this is the cell body, right? The cell body is in between for your sensory neuron, and here you can see the cell body is towards one end for your motor neuron. In motor neuron, cell body also takes part in the conduction process, wherein in your sensory neuron, cell body is not taking part in the conduction process. Also, you can have either myelinated or non-myelinated nerve fibers. What happens in myelinated nerve fibers? Myelin sheath, as you all know, it's an insulator, right? So when you have an insulator throughout the neuron, what happens? The junctions between those insulations, which is called as nodes of Ranvier, right? So the conduction, the impulse has to jump from one node of Ranvier to another node of Ranvier, and the conduction process is much faster in a myelinated nerve fiber compared to a non-myelinated nerve fiber. Also, you have different types of nerve fibers such as A, B and C, right? So the sequence of block for these A, B and C is that the first one which is blocked is B, followed by C and then A. I'm mentioning it because it's very important from an MCQ point of view. Also, your small diameter axons are much more susceptible to a block compared to a large diameter neuron. Now let's see how these neurons are arranged. We have already seen what is an axon. See, this is axon here. Each axon is covered by a sheath called endoneurium. This particular structure here is endoneurium, and all these axons are packed up together in a vesicle, and this vesicle is covered by another sheath called as perineurium. Perineurium here, okay? Now so many of these vesicles are again packed together inside the connective tissue with all those connective tissue contents such as your blood vessels here, then your fat, all those things. So, and this connective tissue along with the vesicles is covered by your outermost sheath, that is epinuria. Okay, that's how the arrangement of the neuron is. Now let's see what is happening in a nerve membrane in a resting state. Okay, here you have your extracellular space, this is the intracellular space, and this is the nerve membrane, right? In the nerve membrane, as you can see, there is potassium pump, sodium pump, all these all these are traveling inside and outside. Now the concentration, look at the table below. The concentration of potassium ions intracellularly is much higher, right, compared to the extracellular concentration. And also the sodium ion concentration is much higher outside when compared to inside. See here, potassium is more inside and sodium is more outside. And the ratio between intracellular and extracellular concentration is given here. This is all very important from an MCQ point of view, okay? So, in a resting state, what happens? The resting membrane potential, that is negative minus 70 millivolt, okay? And at a resting state, look at the permeability of the nerve membrane. It is slightly permeable to sodium ions, freely permeable to potassium as well as chloride ions. And what you see down here, the firing threshold. What do you mean by a firing threshold? In order to conduct an impulse or to create an action potential, you need to have a stimulus which will raise the resting membrane potential from minus 70 to either minimum minus 60 or minus 50. So if there is a stimulus which is capable of increasing the resting membrane potential, that is a minimum with a minimum voltage difference of 15 millivolts, what happens? An action potential is generated and an impulse is transmitted through the nerve membrane. Let's see in different steps what happens. So for the first one, here is the resting stage, right? We already know the potential difference between the intracellular and extracellular space. Now what happens during depolarization? When an action potential is generated, what happens? The sodium pump opens and there is an influx of the sodium. The extracellular sodium is going to come inside and it increases the potential inside. And what happens? It increases up to plus 40 millivolt. Your membrane potential increases to 40 millivolt. This happens in 0.3 milliseconds. Note it down, okay? And this state is called depolarization, the second stage. And what happens after depolarization? The impulse is sent through the nerve membrane. Now it has to go back to its original state, that is repolarization, right? So during repolarization, all those sodium which came inside has to go out, and to take it out, it is an ATP requiring process. It's an active process, okay? And this happens in 0.7 milliseconds. And at the end of repolarization, you have a membrane potential of minus 60 to minus 90 millivolt. All these numbers are very important, okay? Now let's move on to our mechanism of action of local anesthesia. So many theories have been proposed to explain the same: acetylcholine theory, calcium displacement theory, all that. But the most accepted one is specific receptor theory, and I'll be explaining that one in detail here. So let's see. We have already seen the basics, right? So these are your sodium channels. This is the first one is the sodium channel which is open, and the second one is the sodium channel which is closed here. And in the third picture, you can see this RNH plus, that is your local anesthetic. It goes and plugs the sodium channel and it blocks the sodium channel and thereby inhibits the generation of an action potential. In simple terms, this is how the specific receptor theory works, and there is a blockage in the conduction process. It's explained a little detail in this image. Look at this is your sodium channel, and look here, lidocaine, prilocaine, all your local anesthetics. They come and bind to this receptor here. This is a local anesthetic receptor which is there in the sodium channel of the nerve membrane. So when they come and attach to this receptor, what happens? These are the openings and closing. This is the closed state, right? And these are the open state. These channels will get closed when they attach, when these local anesthetics get attached to this receptors. It will lead to the blockade of the sodium channel, and it will inhibit the influx of the sodium ions intracellularly, thereby failing to a generation of an action potential. So this is how specific receptor theory works, and this is how you inhibit the action potential, or you inhibit the normal conduction process, and thereby you acquire anesthesia of that particular area. So I hope it was clear for you all. So stay tuned for more videos on local anesthesia. Also put in the comment section if you need clarifications or if you need any other particular video. Thank you so much.